Hi guys, Dr. Loretta here. So by the end of this video, you're going to be able to identify whether or not you have experienced childhood emotional neglect. If you hated your childhood or have problems embracing your emotion, it could be signs that you experienced childhood emotional neglect and haven't realized it. Emotional neglect is one of the most common type of adverse childhood event. According to statistics, a larger portion of adult population, owing to about 36%, reported childhood emotional abuse. 18% reported physical abuse. 8 to 18% reported sexual abuse, and 16% with physical neglect. Compared to other adverse childhood events, child emotional neglect is more prevalent. What is childhood emotional neglect? Childhood emotional neglect is an inadequate response of a parent or a caregiver to a child's emotional needs. This lack of emotional availability happens when parent, guardian, or caregivers are disregarding of a child's emotional needs, like totally ignoring a crying child constantly, emotionally unavailable or distant. Example, a child falls in the playground and is crying, and instead of being given a hug, you're telling that child to stop crying like a baby and just refusing that child affection, which is an invariable way of telling a child that their feelings don't matter. Lack of validation, like a child being hit by someone or something and told to quit their emotional responses, or told something like, besides, you did not get hurt, or why are you upset by something so little? Lack of support, like a child losing their game, and instead of being encouraged, they are told, next time you do better. Or even with pleasant emotions, like when they're excited for getting a B in a class test and they are being told, why not an A? And almost never compliment that child, always disregarding their needs. Lack of attention. There are age-appropriate levels of independence. For instance, a parent sleeping off a hangover and letting a toddler fend for themselves, or leaving a child hungry, or even punishing them with hunger, or a workaholic parent who gets home extremely tired and exhausted after work that they can barely pay any mind with helping that child with homework, with anything at all. Or they just keep that child in front of a TV or with an iPad to keep them calm. Ignoring a child's feelings and dismissing them as unimportant, irrelevant, or overreaction, or sometimes telling the child how to feel or to stop faking it. Sometimes over the top to where a child is being punished for expressing painful emotions such as anger or sadness, and not giving them a listening ear when they are communicating. Socially isolating a child from others such as peers or loved ones. The damaging fact of emotional neglect is the fact that it is not tangible. It is the fact that something needed for development and well-being was not given. So sometimes individuals are unable to identify that this in fact happened to them even in adulthood. Some people do not even remember because it did not happen. Exposure to adversity affects the development of a child's brain. They are more likely to engage in high-risk behaviors, delayed development, cardiovascular issues, anxiety, depression, cancer, trauma, and other behavioral issues. The fact that this happened in childhood is very damaging because at this stage, their brains and their body is still developing, which affects the brain structure. Let me break it down for you so that you understand how these health issues ensue. When people face adverse life events, they are very likely to experience very strong physical reaction, which is called the fight, flight, freeze response. In fight, flight reaction, your body is trying to get you prepared to either fight or flee danger. The goal here is to get all the blood and the oxygen out of your hands, feet, and big muscle groups, like your thigh and your forearm, so that you can run or fight. To do that quickly, the blood leaves your stomach or your head. You might feel like you've been kicked in the gut or that you're about to faint. Your body stops fighting off diseases and digesting food. You might have trouble thinking at all, let alone thinking rationally. The same things happen in the freeze response, but in this case, your body is trying to reduce both physical and emotional pain. You may have stopped feeling the pain or have the sense that the event is happening to someone else, like a movie. You might have been completely shut down emotionally, or even had shifts in your perception, like you're out of your body or like time has slowed down. Now, having this knowledge, I hope it makes sense to you why these individuals are predisposed to all the aforementioned risk factors. Childhood emotional neglect can have a lasting impact, and the signs of it may be present even in adulthood. And it is essential to recognize them so as to be able to seek appropriate resources and support to be able to address the impact of this experience. So, here are 8 signs to identify that you experience childhood emotional neglect. 1. Dysfunctional and toxic style relationship. This comprises of insecure attachment style and poor relationship with parents. They are repeatedly drawn to people who treat them poorly, poor relationship or bond with parents, and exhibit poor boundaries. With these individuals, their emotions have always been put in the back burner, that they do not understand it or how to express it. You see codependency in their relationships, which is a dysfunctional relationship style majorly characterized by imbalance where one individual is overly giving without receiving. Non-assertiveness where one gives all their self at the expense of their own need and want. This individual is overly the constant giver of love, care, and support, with their primary focus being on pleasing the other person. These givers tend to have low self-esteem, lack of confidence, people-pleasing, do not and cannot set boundaries, and would usually not ask for help. 2. Difficulty with pleasant emotions. Emotions for these individuals are more anxiety, there's lack of confidence, low self-esteem, poor self-image. 3. Potentially damaging behaviors. Overcompensating when raising their own kids. Very clingy, aggressive, anger outburst, conduct disorders such as running away from school, potentially become passive, difficulty focusing or paying attention, dissociative tendencies, fear of intimacy, and lashing out to be heard. 4. Difficulty regulating their emotions. Because their emotions were always neglected, they are usually emotionally unaware and have not mastered the art of regulating their emotions. So their emotions run wild and they're unable to manage their emotions or their emotional reactivity. 5. Low self-esteem. There is a lack of confidence and a fear of being judged by others because their emotions have been judged through childhood. Their emotions were so neglected that they are left feeling insignificant or unworthy. When a parent or a caregiver fail to provide emotional support, the child usually internalizes it to beliefs of inadequacy or worthlessness. 6. Avoid childhood memories. They avoid memories that remind them of their childhood due to painful memories that come with it. Hang in there with me because there are 2 more signs to go over and how to heal from it. 7. Disregard your emotions. They have mastered the art of ignoring their emotions because their emotions were never acknowledged in childhood or told directly or indirectly to ignore their emotions. Emotional neglect can lead to these individuals shutting down their feeling and stop reaching out for support. 8. Reduced sense of social support. Children who have been emotionally neglected are usually socially impaired and have emotions which lead to poor satisfaction in life, poor peer relationship, and social withdrawal. They lack social skills, which creates difficulty in making and maintaining relationships. On the other hand, these individuals have trouble trusting and relying on others. They have learned to become self dependent, however, not in a good way, that they find themselves avoiding asking for help. You could be experiencing some of the above mentioned signs, and it could be better explained by other childhood adverse events other than childhood emotional neglect. This is why I would highly encourage you to talk to a therapist for a better assessment. Childhood emotional neglect sometimes can be unintentional. Sometimes it could be parent, guardian, or caregiver who have been neglected themselves. With a history of trauma, mental illness, physical illness, substance abuse issues, financial stressors, emotional unintelligence, life stressors, and a lack of self awareness. Healing from childhood emotional neglect requires you to first identify that you have experienced childhood emotional neglect, then acknowledge the pain and the hurt from this experience, and show yourself compassion and understanding. Seek professional help if this is impacting your life, or better still, don't wait until it starts to impact your life. With therapy, you can learn healthy coping skills. Your therapist can work with you on how to heal your inner child, write a letter to self, teach and work with you on developing emotional awareness, and practicing non judgmental emotional awareness.